Our new study is calling for an urgent need to redouble vaccine efforts after it came to light that 2.1 million vulnerable people are still fully unvaccinated and 600,000 have yet to get their second dose. Well, the think tank, the Adam Smith Institute, suggests mobile vaccination units and home visits should be in place to protect those most likely to be hospitalised.
Well, James Lawson, Senior Fellow at the Adam Smith Institute, joins us now. Good morning, James. Thanks for coming in. Just tell us more about this research, what you found.
Good morning. So thank you very much for having me on the show. Basically, we looked back at the data, if I set the scene, and the vaccines have proven extremely effective. So there is a vaccine dividend where we are reducing the number of hospitalisations and deaths by as much as 90% as a result of the protection that they provide. But at the same time, the virus is becoming endemic and there are variants. And so we're now at a point where we really need to learn, how do we live with this virus? And so what we did is we looked at all the data and we've come up with 21 recommendations on how the government can further boost the vaccine campaign, inject additional societal resilience in so that we're not tempted or compelled to lock down ever again. And then most fundamentally are in a position where we can protect liberty, where we don't need to do vaccine passports, where we aren't tempted to do another lockdown, where we can allow the Coronavirus Act to expire. And the most important of those is refocusing our efforts on the phase 1 vulnerable group.
So with Boris Johnson announcing his winter plans tomorrow, what you're saying is actually the reliance which there now seems to be on the vaccine is well placed.
I think it is well placed, and the most important thing is to get round these 2.1 million and 600,000 who are either fully unvaccinated or haven't had their second dose.
Yeah.
And what's interesting is if you talk to these people, if you do focus groups or polling, the vast majority of them actually want to have the vaccine. It's not that they're all anti-vaxxers. The vast majority want to have it but haven't for various reasons.
But I want to pick up on that because there's an uncomfortable level of non-uptake in black people and in some other ethnic groups, and that's causing concern. Do we know what that is?
So I think there's a host of cultural reasons why someone might not want to get the vaccine. You don't have to be an anti-vaxxer. A lot of this is about distrust in the state as a whole. It's sometimes out of various concerns. So I think we do need to try and address those head on. But even if we accept that many people won't get the vaccine, and I think that's right, if they don't want to get the vaccine, we shouldn't be compelling people, and hence why I'm against vaccine passports. We can go around those who are ready and willing to have it, because they are the ones, this phase 1 group, they are associated with 99% of the mortality risk. So these are the people who are going to be hospitalised and die. They're ready and willing to have the vaccine but haven't had it for various reasons, or they've only had one dose, maybe they missed their second appointment. So why not double down our efforts there? And then I think in addition to doing that, we need to accelerate the booster shots. We need to expand the scope of booster shots to the entire adult population. We need to be using things like mix and match to give us more supply flexibility and actually better protection. We need to be extending the flu vaccine to the entire population, offering that to anybody who wants it. There's a host of things we can be doing that will make this vaccine campaign much more effective, provide an additional layer of resilience, and enable us to avoid the need to return to restrictions and avoid giving government any temptation to do things like lockdowns and invalid again.
And you're suggesting these mobile vaccination units, also home visits, which is a great idea.
But because ultimately, if someone hasn't been able to get it so far, after many, many months, it's perhaps because they're in their 80s, perhaps their wife is sick at home and they don't really feel comfortable going out of the house. Well, why not do a home visit? The cost to the economy, the cost to lives of this virus is so significant that I think we can very easily afford to send somebody around and make sure that they've got that additional level of protection.
The worry, James, is all it will take is a new variant, and things could change very, very quickly. Are we resilient enough now to bring in measures that can in some way mitigate that?
Well, so a part of the paper looks at how do we deal with variants in future, and so it's also about simplifying regulations around the approval of new vaccines, particularly when we're using the same vaccine platform. So this is something that we do with flu every year. There's an established process. It works really, really well, and so we need the same process or a very similar process for COVID. The good news is that even with the Delta variant, while the Delta variant spreads more easily than the original now. The vaccine still provides really good protection against hospitalisation and death. And so the single most important thing is to redouble our efforts there, as I said, on the phase 1 vulnerable, and then through a host of the other 21 recommendations we have. But once that's done, and once we've simplified how we can get new vaccines in, I'm very confident that we will be a very resilient society, and we can move into the winter with confidence and with courage to know that this pandemic is on the way out.
Yeah.
It's funny, just talking to you for what, a few minutes we've been talking to you, and I've probably got a clearer message than we've had for many weeks, you know, and it's the messaging that we seem to have a problem with. We have a health secretary who goes on to one station one moment with one message, an hour later, a different message. That is very confusing to people, and that's part of the problem here, is the messaging of all this.
Oh, I mean, I've certainly found it confusing myself, and after we were getting up to the publication date, constantly having to go back in and change bits because the policy had changed back and forth. Just in the last two weeks, when we were briefing MPs before the paper's launch, they were telling me that the battle against vaccine passports was long lost, that we had no hope, and that, you know, maybe we should drop it from the paper. And they said, no, let's keep focus on it. And I think that battle is still under dispute, right? In Scotland, they're probably still going to progress with vaccine passports. Who knows what will happen in Wales and Northern Ireland? But fortunately, it now looks like in England, as Sajid has said, that we won't proceed with them. And so I think we will hopefully become a bastion for the free world of this is what you can do, and it can be safe, and you can be resilient, and you can move on. Absolutely. Because we do one day need to move on from talking about COVID every morning at 6 in the morning.
Brilliant, James.
James, yeah, enjoyed that. Thank you very much, James Lawson. Thank you.
And very clearly put, yeah.